As Nigeria battles to win the war against COVID-19, there have been increasing reports of patronage of private hospitals, particularly by high-net-worth patients. Now, this has been accompanied by several consequences ranging from infection and also death of doctors and nurses who are apparently, as they say, ill-equipped to deal with such medical experiences. Now, there is also a lot of fear of this and a lot of fear of private clinics doing this, a situation which has been blamed on the fear of being stigmatized in society today. Now, the call continues to intensify for the authorities to ramp up public testing in order for us to undercut such fear and also make the best use of the ongoing lockdown in high-risk areas in the country. Now, a lot of counselling has also been recommended, in addition to speaking up and reassuring by those who have gone through the horrors of the disease. We're now going to attempt to break down all of this by speaking with Mrs. Eyamba Dafinone, a property developer and also council member of the Manufacturers Association of Nigeria. She's also the vice president of the Nigeria-Vietnam Chamber of Commerce and a member of Vision 2020, a Vid art collector too, and chief executive officer of Afrique Products Limited. Recently, she did contract COVID-19. However, she was last week cleared and discharged from the Infectious Diseases Hospital here in Lagos. Mrs. Dafinone is here to share her story as a way of dispelling fear and stigma associated with COVID-19. Welcome to the program, ma'am. Thank you for joining us and your willingness to share your story today.
Good morning, Mrs. Dafinone. First, let me thank you for agreeing to this interview. I salute your courage, considering the fact that persons who have survived COVID-19 or who are COVID-19 patients are now being stigmatized in Nigeria. In fact, the Minister of Health and the CEO of the Center for Disease Control had to say that Nigerians should not stigmatize anybody. But in spite of that, you have chosen to have this interview. I would like you to just take us through your experience and also comment on the stigmatization of persons who may have been treated for COVID-19. What has your experience been? How did it happen? And why did you take the steps that you took?
Okay, good morning. My name, as you know, is Eyamba Dafinone. I traveled recently to England just for a couple of weeks. And while I was there was no talk about coronavirus there. So during my stay, I did the normal things, went to a restaurant, went to process a visa at the American Embassy. I went to a show, theater show, because my friend's daughter was the lighting designer. And thereafter, a friend of mine died and I had to go for wakekeeping. While I was there, somebody sneezed and I panicked. And a couple of days later, Boris Johnson started talking about coronavirus and its implications. And I then realized, in this last few days I have been out, I might be exposed. So what I then decided to do was talk to my husband and tell him that, look, I'm not sure that I have been exposed or not, but I think it's best that if I do come home, that I go and self-isolate in a different compound, because his mother is over 80 and his siblings are asthmatic. And I just thought it was the best thing to do. He wasn't sure about it and he said, have you got corona? And I said, I don't think so. I haven't been tested, but that I just think it's the prudent thing to do. So what then happened was I made arrangements in a different compound to have it set up. And from the airport, I went directly there. He did say that, why don't you stay in England? And I said, look, I'll just be NHS statistics. I'd rather come home. That this, I feel, was like a tropical disease as against a neurosurgical or you needed operation. And I'd rather be at home where I felt they could deal with these sort of diseases. So I came back to Lagos. And when I was in Lagos, we live in Apapa, but I moved to Victoria Island. I was there on my own. And during my stay there, I arrived on Saturday on a Virgin flight, 21st. And on the Monday, it was my birthday, and I asked to do a self-isolation party. So I got a lot of cakes, presents, and all kinds of things, and flowers. And the very next day, I started having pains. And I thought maybe I wasn't used to the mattress. And then what then happened was the next day, I had runny tummy. And people said, oh, you ate too much cakes. It was your birthday. That's what happened. And I said, okay. And then the next day, I had temperature. They said, oh, but you complained that you had a mosquito bite and you saw mosquito blood. So maybe that's the reason. So every symptom that happened, there was an excuse for it. People thought there was really nothing wrong with me. And then I started sweating. And my friend said, oh, this is menopause. You reached that age. So every time I had something, there was a reason for why I was having it. And then I now found that I had a fever. The fever wasn't going, and I started having rigors, shivering. And the kind of sweats I had was water dripping. You'd get up and water would drip all over the floor. And I'd be like, this isn't normal. Subsequently, I was exhausted and tired. And I felt it was time to call a doctor because I didn't understand. I wasn't coughing, I wasn't breathless, but I felt this wasn't normal. And when I called the doctor, they monitored me on the phone and they were looking at me, and they now gave me an oximeter and said I should monitor my oxygen levels. They also decided that it was best that I had blood pressure machine to monitor my vitals. And this we did for about a couple of days, but I only got worse. And in the process, they said, look, they felt it was best that I got tested, especially when they asked, can you smell? And I said, I can't smell. They said, no, it's time to get tested. The testing process wasn't easy. We had to call and call connections from commissioners to PEMSECs to everybody in Lagos State government before we finally got them to agree. And I got a phone call that they were coming to test me at home. 2 doctors came, they tested, and then I waited for my results. And I waited for my results. I didn't get the results on time. And then I called them. I said, I'm not feeling well. They said, do you want to come in? I said, I don't want to come into that place when I don't have my results. How can I come into that place when I'm still, I don't know if I'm positive or negative. The next day, I felt so bad. I called them and said, results or no results, please come and collect me. I can't wait anymore. So they said, are you sure? And I said, yes, I need to be with a doctor. And I can't go to a private clinic because, I don't know if I have it. So I'd rather go where they have doctors so they confirm what is wrong with me. So they brought the ambulance and they brought a fumigation van. And when I was taken, they fumigated the apartment where I'd been staying. And we'd headed off to, my husband had come because the doctor had been worried and had told him to go check on me. So he was in the compound waiting and he followed us. And we then went to the IDH Yaba. I didn't know where they were taking me to because I wasn't really paying attention. When I did get there, I was taken to a tent, a very huge tent. And there were just 2 people in the room. And it had a capacity for maybe about 16 people. And I was told it was a holding tent for those who had not been confirmed. Okay, I said, okay, no problem. The next day, they came and they confirmed me. As I was leaving, the lady opposite said, are you going home? I said, no, they're taking me to the main ward. She said, why? That I am negative. I said, really? I said, but at night, I had to call the doctor to come and give you oxygen. You were gasping, you couldn't breathe. Please let them recheck you. And I left her there and I went to the main ward. But what's important, when they were taking me, before they took me from the house, they did say, look, we don't have any private wards available. Do you want to wait? I said, no. I'm ill. I don't care about the results. I don't care where I'm being taken to. I need to have medical care. So I now went to the wards, and it was a room for 6 people, and there were 4 of us in there, and it was good I was with people because there was a lot of love, a lot of support, a lot of intershared stories as to what had happened to them. And what I think is important at this point is to try and point out that everybody's symptom was totally different. And the stay there was good. I had a bit of nausea because of the meds, but it was good. There was care. Being in IDH was amazing because they have the protocol. They've been there for 90 years. They know what they're doing. They're once in charge of infectious diseases, and there's no other place to go to when you suspect you have this kind of thing. Calling a doctor, not letting him know what you have is really, really complicated. But I just felt it was best to be at the correct place. When I left, they did decontaminate me. They used chlorine all over my body. I was a wet rag. They decontaminated my clothes, my computer, my laptop, and I was dripping, confused, and left. That's where I probably see there's a problem, because they never told us what would happen thereafter. I was like, go home, and that was it.
Mrs. Dafinone.
And that was my experience, and I'm happy.
Thank you.
Yes.
Thank you for walking us through this. And throughout the course of this conversation, we will break it down a lot more. And first of all, it's glad for us to hear that you're a lot better and doing a lot better. And you've spoken about a lot of different experiences that you had along the way. Now, going back towards the start of the conversation, you said that you chose not to stay in the UK because you didn't want to be another NHS statistic. And we already know the NHS is a huge victim of austerity. And over here, really and truly, the healthcare system in Nigeria as well is overwhelmed. So a lot of people had worries about the state of our isolation centers. But from what you have said now, you had quite a good experience with our isolation centers. But let's go into a deeper conversation on that. Do you think our healthcare system right now is overwhelmed? How do you see our healthcare system coping with the rise and increase of COVID-19 cases? And what was your relationship like with the doctors, the nurses at the infectious disease hospital in terms of stigma, in terms of care, etc.?
Okay. At the hospital, I found that because they're funded by WHO, USAID, and CDC, that the facilities were impeccable. The beds were new, everything was new toilets. I mean, they had standing air conditioners, they had sitting fans. It was okay. There was nothing I wanted that I didn't have as in a hospital. I was ill, I was on a bed, and I needed care. The doctors and nurses were very good. To be honest, they were all in hazmat suits. I wouldn't recognize them if I saw them tomorrow. They just came, they tried to be as cheerful as they could. But their job mainly was to just give us our medication and check what symptoms or ailments we had so that they could try and alleviate it. So there wasn't much interaction, really, apart from, are you all right? To be honest, some other people said they had calls from physicians, from psychiatrists, to let them know what the effects of the drugs would be, but I didn't have any of that. That was explained to me much later when I was about to leave, what had happened, that they had mixed up my numbers, so they couldn't reach me. But in terms of care, I mean, these people know what they're doing. Yeah? When they leave every day, they get decontaminated, okay? When you leave, you get decontaminated. If you want to take anything away from the premises, it's decontaminated. The healthcare system, when you ask the question of whether it's overwhelmed, it certainly is not overwhelmed at the moment because we haven't done enough testing, okay? So they don't have enough pressure from patients. But as we were leaving, towards the latter part of my stay, when I went for my fresh test, I noticed rather than one patient coming and maybe two patients coming, 6 patients were arriving at the same time. I was told later that when I left, that somebody did come and passed away, but when tested, it wasn't COVID. So the point is, I mean, the poor person stayed at home for such a long time rather than coming to the hospital, thinking they had COVID and there was stigma, okay, and only to come, die, before, like 5 minutes after being moved out of the ambulance before they got to the room, and they didn't have COVID, okay? In terms of stigmatization, the healthcare workers, you know, they're taking a risk. They're taking a risk, okay? They're there. Most family members are scared for their lives, okay? There was a lady there who said she was treated like a leper by her family because she arrived and she was coughing at home and coughing at home. Everybody was like running away from her, that you must have corona. Nobody would touch her. She almost couldn't even get to the hospital because they were so nervous about it, okay? And the workers, so long as they had protective gear, would come in, the cleaners would come in, they would clean regularly. There was a time we had a clogged shower. The next day, or maybe the same day probably, a plumber came, they fixed it. If there was a problem, it was fixed, okay? The funding on that facility is excellent. And everything was done. They had flat screen TVs. At the moment, as we speak, there's no pressure, okay? But if it escalates the way it might escalate, if certain things aren't done, then of course we're going to have serious problems and we will not be able to cope. Okay. I'm not sure if I can talk about the various symptoms, because my concern at this point in time is how we can get people tested, okay, and how we can get people not to be scared about the stigmatization and come out for testing.
Well, I mean,
hello?
It's quite interesting having this conversation with you. You look great. You look excellent. I was going to ask you another question. Hello? Can you hear me? And I was saying that...
I can hear you.
That this is, for me, a very happy conversation. You look great. You look excellent. I hope your husband doesn't mind me saying that. And, you know, we're glad that this is a happy ending. But you are Eyamba, a princess. I guess that's a royal name from Enshaw Town in Calabar. And you are married to Dafinone, a family of accountants. But what advice do you have for people who do not have the privilege to make a phone call, to call a doctor, and who are likely to just hide because they are handicapped, they are perplexed, they don't even trust government? What will you say to such persons about seeking help, about the choices available to them?
Okay. What was interesting in my ward was that people were from Egbeda, people were from Opik, okay? There were mixed people in the ward, and I asked, oh, how did you get here? And they felt they had symptoms, and they just drove to IDH, and they got tested. The testing capacity hasn't been fully utilized. Nigerians should go and get tested. What I believe NCDC should do is to lay out all the addresses where testing can take place. What NCDC should do is lay out all the phone numbers, okay, that can be reached so that people know how to get tested. I phoned the ones that were online and they didn't work. I did try that first, okay? But other people, some people just drove themselves there and insisted. Somebody said they used the International Research Center beside Presbyterian Church in Yaba. They went online, they filled in a form. 3 hours later, they responded, and they did a drive-through testing. Testing is free. Testing is free. Nobody has to pay for testing, okay? I hope that answers that question.
Thank you, ma'am, for that clarification. And yes, to be very honest with you, the more we test, the more we know. So we do have to continue to encourage to test, test, and test. Now, when you started off speaking at the start of this conversation, you also spoke about how when you were showing symptoms, nobody around you actually wanted to put those symptoms towards COVID-19. Instead, it was affiliated with so many other things, malaria, menopause, and that is a huge part of the stigma. Now, given how prevalent stigmatization is right now in Nigeria, do you have fears that the current numbers we are seeing really and truly don't reflect what the situation actually is? And do you therefore, what are your views therefore on the lockdown that we are currently under and a possibility of extension again?
Okay, could you say the last line, because I had problems hearing your very last phrase.
Yes, I said, and therefore, what are your views on the current lockdown and a possibility of extension again?
Mm-hmm. Okay, I'll talk about the stigmatization. What it is that, one, it's the culture in Nigeria. The culture is that of secrecy. You ask somebody, when's your baby due? They don't want to tell you. You ask them something, don't let anybody know. Okay, so you can imagine somebody having or thinking they have COVID-19 and then hiding it from everybody. That is taboo. Nobody must know. And so they stay at home. They're getting ill. They don't want anybody to know. Sometimes they go to the doctor and they do not even give their travel history and expose the hospitals. Okay, there was a case of a girl that came. She was only brought to Yaba because her grandmother had died. Okay, and people are so scared of people talking about the fact they have COVID-19. But what is COVID-19? It is a cold virus that is deadly. It's a deadly virus, yes, but you catch it as you could easily catch a cold. You could just brush past somebody and get it. You don't know you've got it. It's not a sexually transmitted disease. It's not gonorrhea. It's not syphilis. So why do you have a stigma? Why can't you come out and say you have it? Why are you hiding at home? What I would encourage is that most people are telling their pastors they're ill, okay? The pastors, the reverend fathers, those they've told, please persuade them to go to the correct place for testing. Please. Because if we don't test, what they're doing is potentially killing people in future. We must contain it. We must contain it. I don't know if it's based on ignorance. I mean, they're meant to be so-called elitist, but the people there were people, as I said, from Egbeda, Opik, and other places. More of them so there than anybody else. Although at the center, there was a little 10-year-old Indian girl with her mother. With the men, they had a lot of foreigners and everything. But a lot of people, given the amount of flights that came into Nigeria in February and March, given the fact that everybody I met in London is okay, everybody's perfect, I probably caught it on the plane. There must be other people on my flight that caught it. Where they are, I don't know. Maybe they're better because it's now 3.5 weeks or 4 weeks, but they would have infected somebody else. We need to contact trace and find out those that they might have infected. What we also need to do is have a data bank of symptoms so that Nigeria understand what the symptoms are. Mine were body pain, diarrhea, fever, sweating, rigors, splitting headache, weakness, delirium, vomiting, no smell. Some other people had absolutely no symptoms. They just felt, I was with my husband, he has it, let me go test. They had it. Some people were dizziness, watery stool. Some had cough, some had fever. Somebody, nothing, no temperature, no pains, just loss of smell. Everybody is different. So I believe there should be a data bank of symptoms so that Nigerians will recognize when I think I have it. Those pains I'm talking about is like 3 men punching you, leaving you, coming back and punching you again. But I convinced myself that it was bad mattress because I didn't want to believe I had COVID. Okay? Some people have itchy eyes, watery eyes, their ears, they can't hear very well. Some people are gasping. There's a lady, she had no symptoms. She just woke up at night, very late at night, told her husband, I can't breathe, I can't breathe, I can't breathe. Symptoms are different. But if there's a data bank of symptoms, Nigerians will recognize it and then know who to call. But what is important is people telling their loved ones at home and telling them, why are you scared to test? Why are you scared? This is just a cold virus that is deadly. Why are you scared? Please go help. IDH Yaba has 100% success rate. Nobody has died there. The person who came was already dying and didn't even have COVID. 100% success rate. With that success rate, I would have thought it would give Nigerians confidence and know that, oh, what we're doing in Nigeria is working. What we're doing in Nigeria is working. And if it's working, why wouldn't you go and test and make sure you stop the exponential growth? When we don't test, our testing has been so little, only 7,000 or under 8,000 have been tested. With our population of 200 million is 0.00035% that have been tested. What is that? That means our figures are grossly underestimated. However, with testing, it is a step in finding out who has it. Lockdown, a lockdown without testing is a meaningless lockdown. A lockdown without testing is a meaningless lockdown. There's so many things that should be done during this lockdown. During this lockdown, I would have thought that we would look at the realities of if a lockdown would work. Can a lockdown really work if people are hungry, if people are starving? What are we going to do to ensure we convince the masses that there is need for a lockdown? That interaction, that education, that carrying the masses along so that they understand the need for a lockdown is important. We cannot do it top down. You have to do it bottom up. WHO has said 10 million people could get infected in Nigeria. 10 million people could get infected in Nigeria. Not in Nigeria, sorry, in Africa. Now we have 17% of the African population, which means 1.7 million Nigerians could get infected. Now, what are we doing about that? Michael Yell says, Ebola, what our expectations are, didn't happen. The only way it will change if there's a behavioral change and we change the way we behave, then we will stop the problem. Now, how do we change the way we behave? I'll give an example. The ways we even give out the food is aiding the virus spread. They come with the van, everybody crowds. You cook the food, everybody crowds. Okay, even when some communities are telling me in Banana Island, Lekki, that they are spacing and trying to do spacing, what happens when they leave? They still go back and sleep together in the same room. So nothing has been achieved. So why don't we look at it from a different perspective? It's not a question of money, spending money in Nigeria. It's not a question of money. We have to look at it strategically and say, okay, where are these people going to sleep? Okay? And then if we, as people who probably can afford to help people, start helping genuinely and show love for the fellow man and worry where they're going to sleep, then things might change. Like number one, if they have a fixed accommodation or fixed residence for those 6 weeks, we could probably should do the clampdown. Because if you do a clampdown for 6 weeks, the exponential growth is arrested. The virus has left somebody's system. It has nobody else to jump to because everybody's at home, and the virus can only thrive when it finds somebody to jump to. If there's nobody to jump to, explain that to the masses, number one. Two, those who are hungry and protesting, find a place where they will stay. They're empty hotels. They're empty office blocks. There's money, buy mattresses. Let's think differently. It's not ventilators. Ventilators is killing people abroad. You've had programs of people saying, oh, we're giving ventilators, they are still dying. We're giving ventilators, they're still dying. A young boy said, I did medicine for I've been here for 9 days. Everybody is dying. If you're treating something and they're dying, it means you're not treating the thing properly. What people need is oxygen. They should buy concentrated oxygen tanks. Concentrated oxygen tanks and help. Even if they buy the ventilators, who is trained on that ICU equipment? How many people have we gotten trained? So let us do things reasonably. We need to find where they will stay. Are there empty apartments? Are we going to deal with estate agents? Okay, who will find? People might laugh and saying, cuckoo. It's a phenomenon, so we have to think outside the box. We have to find a Nigerian solution that works for us, a solution that works for Africa. We know how to look after our people. We have to find places where they can be kept. There are lots of entertainment function halls that are not being used at the moment. Space their mattresses so that people know they can go there and deliver the food. There are loads of empty restaurants. All this food being given out. These guys are daily workers. Daily workers. At lunchtime, they eat their lunch, go home and sleep. Either in the shop or in their master's houses. They don't have cookers. They don't have kerosene stove. So you're giving them yam and rice, they sell it. You're giving them yam and rice, they sell it. The approach is different. They need cooked food. All these mama casses, sweet sensations, tantalizers, they have kitchens, they have staff. Take the food to them, let them cook. It is lifted from them and then moved to locations that are managed. We all did youth corps. We had sergeant majors. Let them try and organize the boys in each of these places where they can live. Let them live in these different places for the interim. But before that happens, they all have group leaders. Call the group leaders and explain to them what you're trying to do. They say Nigerians are brilliant 419ers. Open up a website and tell people to proffer ideas. I don't have the solution. I'm just saying we need to brainstorm and think differently. We are at a cusp. The decisions we make now will determine whether we make it or break it. It is not spending billions up there and saying you're giving company money. It is the fact we have to have lockdowns, but the lockdowns can only happen if you protect the masses. The lockdowns can only happen if you convince the masses why there should be lockdowns. If we have a lockdown for 6 weeks straight, like China did, it will go. Now, these people, these young boys that are protesting on the streets, why don't we take them and train them? Let's train them to do fumigation, train them to do cleaning, train them to pack and deliver lunches. They need jobs. They'll be appreciative. We have to show love. God is love. Love conquers all. I got through being at IDH because of the care and love and the phone calls. The days would go, and I wouldn't even realize the days would go because people were praying, people were calling. I felt blessed. I mean, if we don't show brotherly love, we have to do it differently. We have to do it the African way. All these young guys, all these people, they must be housed for that period. They have to feel secure. They have to feel protected and loved, and not, they are scared. If they didn't believe Corona existed before, now they certainly do, after what happened a couple of days ago. And it's time now to sit down and talk to them. Fine, it's so good what Lagos State has done. It cannot do it alone. Lagos State cannot do it alone. All the states have to do it at the same time. If not, you fix your problem, it's now imported. You cannot do it in isolation. There has to be a global, there has to be a national consensus amongst the governors that we're doing everything we're doing simultaneously. If not, it's a mess. You can't do it one place, stop, somebody else does it. You have to do it. The president has to come in on this and say it has to be done at the same time. They have to talk to those young boys that normally have daily work, and their work has stopped. They make 2,000 naira. They spend 1,000 on food or 1,002 and transport home. Now they're not making the money. Half of them don't have BVN numbers, okay? So we have to look at it realistically. They don't have BVN numbers. You have it difficult to qualify, but however, they do have gangs or people who are in charge of them. The police might even know. I come to another issue on the logistics and the food problem. Even in transporting food, they're being waylaid on the road. They're being harassed on the road. Police has to secure those foods. At the rate it's going, within 14 days, there won't be enough food to feed Lagos of 18 million people because people are going to just give up bringing food into Lagos. So we have to look at everything holistically, bottom up, not top down, and see what are the problems. Lockdown, most people in Banana Island, GRAs, Lekki's, Victoria Island, they're on lockdown. But the rest of Lagos is not on lockdown because they're hungry. Get to Ikorodu. I'm told that Ikorodu is too far. We should even go from Ajah. They are selling curtains and furniture still on the road. If it's going to work, they have to explain. They have associations. They have market associations. They have Okada associations. Oh, sorry, it doesn't exist anymore, but they have associations. Talk to the various association leaders, market women leaders. Talk to those area boys, police know them, and explain to them what we're trying to do. Find those who have empty houses, hotels, halls for functions. Let the so-called people buy mattresses. Let the textiles bring fabrics. We put them as this thing. They must be treated with love. You just don't dump people. Their buckets are there, everything. They know they are loved. They tell you what the expectations are. They will cooperate. Nigerians don't want to die. Those people at home who feel stigmatized, let's forget about stigmatization. You'll be killing people. That's what you'll be doing. If the numbers are given out and they work, please, I would encourage their staff to call the numbers and say, I have an Oga here who is sick. Because we have to arrest it. There has to be cooperation. There has to be unity. We have to do things as one. We can't do things individually. There has to be love. We have to love, we have to care, we want to save Nigeria. Let us show the world that Africa can do it in its own African way. We don't have to follow their norms. IDH is fixing people. I was fixed, I'm happy. You told me I was looking good, so I'm happy, I'm glad. But it's important that everybody has the confidence. IDH has been there since 90 years. 90 years from now is 1930. That's when it was established. It's WHO funded. Everything works. I'm so disappointed that people would call and say, are the toilets working? What sort of question is that? I'm disappointed that pharmacists will call and ask me, what drugs do they give you? If you know somebody who is sick, Send them there. Don't try and fix them. If I want to make a dress, I don't go to a barber to make my dress. These are the specialists. They have been trained. They were trained for Ebola. All their patients were moved out. They were all moved out. I don't feel any stigma. We are all in good company. Prince Charles, the Queen's son, has it. What kind of stigma is that? Boris Johnson has it. What kind of stigma is that? The Canadian Prime Minister's wife, Tom Hanks. It is a cold virus, but a deadly one. It can kill. So it has to be taken seriously because it's
I like the recommendations. I like the recommendations that you have made, and I hope the relevant authorities are listening and watching. But in spite of all the fault lines that you have observed, particularly with the shutdown, with the lockdown, will you support a further extension of the lockdown, or, as some people have suggested, a complete lockdown of Nigeria for a whole month? Because it looks like from 1 to 6/27, as at yesterday, we're going through a second wave of infections. What do you think government should do going forward? Because some people are already saying, oh, they are opening up in Ghana. Maybe Nigeria next week should also open up. What are your thoughts?
They're opening up where next week? Where are they opening up?
No, in Ghana. They are opening up from today, allowing some people to go
Ghana.
to work.
Okay, fine.
Yeah, Ghana.
Okay. The thing I want to say about the lockdown, a lockdown that hasn't got an effective strategy simultaneously happening is a wasted lockdown. Okay? So I believe we need to plan, embracing these guys and finding where they will reside. Because if they are not safe for the period you want to have the lockdown, it's not going to work. We're just wasting our time. Because they're not going to listen to the lockdown. Okay? So is a lockdown, is a lockdown necessary? Of course, that's the only way. China did it. That is the only way we're going to stop the virus. The only way. If it's not done in Nigeria at the same time, forget it. If you need a week of everybody coming out for you people to plan properly, but you have to plan properly. You have to convince the masses. You must convince them why they should be locked down, because they believe it is a VI problem. It is a Banana Island problem. But however, by the time I was leaving IDH, everybody coming in had not traveled. They hadn't traveled. It was people that had never traveled that were now getting it. If you go there now by next week, no traveler is there. It's a new wave that has started. And one person can infect 50,000 people. The one person sitting at home has infected 2 or 3 or 4 or 5 people, and who have now infected 2 or 3 or 4 or 5 people. I'll use an example in Michigan. In Michigan, 3 weeks ago, I was thinking of sending my daughter there because she's in New York. And I called my cousin. I said, you don't have any infection, thank God. Maybe when she finishes this thing, she'll come and stay with you. 3 weeks later, yesterday, I called her. She said, we have 17,000 cases, and over 2,000 people have died, and 83 people died yesterday. In 3 weeks, from 0. That is how fast it grows. We're still at the 500, 600 level because we haven't been testing or anything. If the explosion allows starts, we can't take it. I was talking about the numbers. The WHO said 10 million people could get infected in Africa, and we're 17% of the African population because they're 1.3 billion, which meant that 1.7 million Nigerians could have it. Now, how many people have the potential to die from that? Do we have the facilities to look after people? Not all of them will go into hospital, please, mind you, okay? But are we able to look after it? Can we afford for that to happen in Nigeria? What are we doing? What are governors doing? Some governors are saying if the mucus and the mucus doesn't meet, there's no problem. But it's important that everybody wears face mask. I'm now coming to the PPE gear that they're making. Some people are sewing protective personal equipments in plastic and sewing and making holes for virus to come through. These things are heat sealed. They're meant to be heat sealed. Sorry about the fidgeting of the earplugs. They're meant to be heat sealed. They're meant to be heat sealed. And you're getting people to sew them, further putting the lives of the front workers at stake. The front workers, we should be worried about their welfare. We should be worried about their insurance. They've left their families at home. Luckily, they're being put in hotels free of charge. But their welfare, their remuneration, whatever is promised them, should be paid. The plastic face sheets at the moment, they've been asked to recycle. They are afraid that very soon there'll be no mask. Very soon there'll be no gloves. Very soon there'll be no equipment for them. We should worry about stocking up the drugs that they've been using that is working. We should be worried about stocking up equipment for the front-end health workers. But will we have an explosion? We sure will. But can we flatten this curve quickly? We hope, if we use our natural African sense, which we have. If it's a question of money, the problem would have been solved. You can't compare how much America has or England has than we have. But it's not going to be money that will solve it. It's going to be love. Human love, human care that will solve it. Yes, there is need of a lockdown because that's the only way it's going to be solved. But if we do it independently, we don't do fumigation, all those guys carrying machetes, get them, employ them, train them as fumigators, train them to deliver food. They will be gladly do it, but explain to them why. Explain to them why you need them. Explain to them you will house them in this period. And they will do it, and they will stay, and we will solve the problem in Nigeria. Please, I'm appealing to those at home, to their loved ones, please, that I hope this gives you the confidence that there's nothing wrong. I could stand up and say, look, there's nothing wrong. I was there for 8 days. Before then, I was in isolation for 12 days. Some people are just isolating upstairs and their husbands downstairs. People are finding ways to make it work. But if you know you have a symptom, please, please, IDH, Infectious Disease Hospital, Google it, Yaba. Some people are talking about mainland hospital. Please, that's not it. It's Infectious Disease Hospital. You go past Military Hospital. You go past WAEC. You go past Yaba College of Tech. That is the way to the place. It is amazing. The facilities are great. It's a shame I didn't give you the pictures to pick up because I took photographs of my rooms and everything. There's nothing wrong with it. I was there, I was cured, and I'm grateful to all the efforts by Lagos State government of what they've done. But I'm saying Lagos State, you cannot do it alone. Talk to the other governors. Talk to everybody else what you're doing. What you're doing is brilliant. Talk to them. Thank you.
Thank you very much, Eyamba Dafinone. We've been talking to Eyamba Dafinone, a COVID-19 survivor in Nigeria, a property developer, and a very successful businesswoman.